Namaste. I'm Dr. Shwetha Anand. I'm a fertility consultant, high-risk pregnancy specialist, and a laparoscopic surgeon as well. I practice at Basaveshwar, Nagar at a center called Janisthaa Fertility Center and Hospital. Ovulation is nothing but a release of egg from the ovary. This we term it as ovulation. All of us know what is ovulation. Now, why does ovulation become important? Ovulation is very important for a person who is trying for pregnancy. Now, how do we know that ovulation is happening? First and foremost, when there is ovulation happening regularly, the periods also will be regular. So indirectly it tells us that if a person is having 8 to 30 day cycle, that means to say that she is ovulating regularly. This is one of the way to know that you are ovulating. Now, when does ovulation happen? Most of the time it happens around day 12 to day 14 in majority of the women. So sometimes if the cycles occur earlier or if there is a delayed one, this could be ovulation could happen somewhere between 8 day to 10 day and maybe around 16 day to 18 day, but most common is around 12 day to 14 day. Now, how do we cover the days during ovulation? How do we diagnose it? Or whether you're ovulating or not. Around the ovulatory days, the cervical mucus, so what we call it as white discharge, differs. So you yourself can make out that it would be like a raw egg kind of a discharge, which could be elasticy, and it is not false, meaning it is not like a regular discharge. So it's basically like an elastic, and which shows that you are going through a very high fertile period and your body temperature changes. There could be an increase in your temperature, and around ovulation you might have a little bit of pain in your tummy, or some people also have some kind of spotting during ovulation. Now, we have a lot of kits, ovulation kits that are available so that you don't miss out on the important days of intercourse. Now, ovulation kits, actually you get a single or in a pack of 5 also. What it says is, so it's just like your urine pregnancy test. So you have to use your urine on the test and then see whether you're able to see lines or no. Suppose if you don't see line, then repeat the test again in 12 hours time. Once you start seeing the line, so that means to say that your hormone is on the rise and you are going to ovulate between 24 to 48 hours. So that is when you need to have intercourse to have a successful pregnancy. So these are the ways to know whether you're ovulating or not. Now, the most difficult factor would be in people who are not getting their menstrual cycles regularly. So this is where your ovulation cannot be timed. So what we do here is, we do something called ovulation induction, where we give you simple tablets, injections, do a follicular development, track the follicle in the scan, and then give you an egg releasing injection. So scanning and ovulation induction would be needed in people who are not ovulating regularly. Sometimes what happens is, after treatment with ovulation induction, your irregular cycles might get set right and you might start having periods regularly as well. So these are the different tests that can help you to find your ovulation window.